All right, so welcome everyone to today's Innovation and Improvement Showcase. It's Series 11 and the theme is Strengthening Healthcare Workforce Wellbeing. I'd like to start off by acknowledging that the land we meet on today is the traditional lands of the Kaurna people, and that we respect their spiritual relationship with country. We also acknowledge the Kaurna people as the custodians of the Adelaide region, and that their cultural and heritage beliefs are still as important to the living Kaurna people today. And I'd also like to do a shout out and acknowledge that other lands that people might be joining this session today, and obviously I'm aware that our key speaker today is joining us from Western Australia. So we'll just start off a little bit about the Commission on Excellence and Innovation in Health, or CEIH, for those of you that aren't familiar with our organisation. So who are we? We are the lead agency for innovation and healthcare in South Australia. We bring consumers, clinicians and other collaborators together to turn ideas into better healthcare. And I just realised that I didn't introduce myself either. So my name is Isla Voigt and I'm the Manager for Workforce Wellbeing Partnerships at CEIH. So our vision is together, let's create better healthcare for South Australians. So to do this, we need to support the sector to come together and imagine new ideas for better healthcare. We also acknowledge that better isn't always excellent, but we commit to measuring what we are doing so that we can see changes. So what if the big idea was actually connecting all the small ideas? And in essence, that's why we host this Improvement and Innovation Showcase, which is helping to connect people in South Australia and obviously interstate as well, and share improvements, innovations, and sometimes both. So during a series season, we hold sessions every Thursday at 1 p.m, or they're available online at any time. So we are recording it for people to view later in the time. We're also about bringing healthcare teams together and providing a space to explore what others have learned. We aim to keep it pretty simple and share work happening across the sector at any stage or level of success. So not just waiting for work that's to be complete and perfectly polished and ready to be published. We generally focus on work in South Australia, but every now and again, like today, we'd like to showcase something that's happening outside our state to ignite ideas here within South Australia. So just a shout out that if you do have a story to tell, if you've succeeded in solving a problem or learned something, or if you've got a theme that you'd really like us to focus on, please reach out and contact us so we can put that in plans for future series. So we just wanted to touch on a little bit, I guess, about why CEIH is invested in workplace wellbeing and why this is a really important topic for us. So we know that our healthcare workers need to be safe and well to not only thrive in their professions and have the bandwidth and capacity to go beyond, but also continue to innovate and provide world-class care, patient care. At CEIH, we're really committed to applying global best practice to the South Australian context and supporting the sector to create a culture of workplace wellbeing at all levels. And to support this, we've produced a range of resources and tools that are available on our website. You can see the link there, and we'll also pop it in the chat as well for you to click on. So we're really excited to be bringing this showcase to you to highlight some of the work happening across the sector to protect and promote the wellbeing of our healthcare workforce. This is the full program that you can see on the screen of the series, and we're up to our second last presentation in the series, and we've got one more next week as well. So there is still time to register for next week. So today we are going to hear from Cati Thomas. She's from the Centre of Transformative Work Design, and she'll be talking about partnering to redesign work and wellbeing in the healthcare and social assistance sector. So I will hand over to Cati. Thanks.
Thanks, Isla. Just sharing my screen. Let me know when you guys can see.
That's great. Thanks, Cati.
Great. So yeah, thank you again for the invitation to present. Just before we start, I just wanted to acknowledge the traditional owners of the land that I'm on today, the Whadjuk Noongar people, and to pay my respects to the elders past, present and emerging. Just to set the scene a little bit, we have about 1 in 7 people in the Australian workforce who work in the healthcare and social assistance sector, or HSA industry, and that's approaching around 2 million people. And this is our largest employing industry in Australia, which makes up around 14.5% of our workforce. So these employees are caring for some of our most vulnerable populations in the community. So their mental health and their wellbeing at work, it really needs to be a priority, and they really are the critical workforce for us. Just a bit of a more detailed intro. My name's Cati. Very long title, but I'm a work performance psychologist and researcher. I was reflecting on a bit of a fun fact or interesting thing about me to include in the presentation, and realized that I had been working in health or health adjacent roles for now over a decade, almost close to 15 years. I started as an admin assistant and then was a researcher, and now a psychologist working with employees in HSA, so kind of come full circle. And working with health employees has really been a big part of me in the work I do for such a long time, which is really great. And currently I work for the Centre for Transformative Work Design, which is part of Curtin University's Future of Work Institute here in Perth. And the Centre, or CTWD, is where we have organisational psychology researchers and practitioners who come together to collaborate on transforming work. And we operate under the Thrive at Work model, which I'll explain in a second. And we've got Professor Sharon Parker, who's the director for the CTWD. And today I'll be talking you through some examples of Sharon's work, and in particular her smart work design model and some examples of work redesign that we've done or are currently in progress. And then I'll round out with some key takeaways for you in terms of what we've seen is contributing to successful and sustainable redesign in the sector. So when I'm talking about mental health, we use the World Health Organisation's definition, which is a state of mental well-being that enables people to cope with the stresses of life, realise their abilities, learn well, work well, and contribute to their community. So it's really not just focusing on the mental ill health part, but considering the whole spectrum. And the Thrive at Work model is this holistic, prevention-oriented and proactive approach to mental health at work. And we've got these three pillars of mitigating illness, preventing harm, and promoting thriving. So as I said, we work across the spectrum. And this is from this mitigating illness pillar, where the strategies that we'll put in place are things like raising awareness, providing support, and building capability, towards this promoting thriving and growth pillar, which is achieved through fostering learning, purpose, and connection. And I work in this middle pillar here, which is the prevent harm space. And this is where we see organisations needing the most help. And we do this by designing good work. So work design is exactly what it sounds like. It is how your work is designed. And simply put, it's the resources and the demands that we have in our job. So you can think about it as the features that make up work, and specifically it refers to the content and organisation of your work tasks, the activities that are involved, the nature and the quality of the relationships that you have with people in the organisation, your role and your responsibilities as well. And the reason why work design is such a key strategy in this prevent harm space is because there's over 100 years of research that shows us how important it is for a variety of different outcomes. So things like productivity, well-being, strain, absenteeism, presenteeism, where you have people showing up and coming to work when they really shouldn't be because they're sick or for whatever reason. Job satisfaction, organisational commitment, creativity, and heaps more. So work design really is this crucial strategy to preventing harm, because when we see, for example, the effects of stress, sometimes you'll have organisations that will react by referring to counselling or to EAP. If you see something like low job performance, then maybe training is the answer. Or if you see low innovation, low creativity, then maybe fun zones, or like, table tennis or things like that are implemented in the organisation. And it's not to say that those solutions don't work or that they don't have any merit. But if you take the EAP example and the stress example, we want to be able to design work where it's not getting to the point of stressing or burning out the employee so badly that they're needing to seek EAP. We want to instead be able to address the root cause to prevent harm. And that's the way that the employee is actually experiencing the job itself. So we want to understand, okay, well, how is work designed? And then once we understand that, we can improve the stress levels, the performance, the innovation, and anything else that enables employees to do their best at work. So to explain what exactly good work design is, Sharon Parker developed this smart work design model. And just for context, Sharon is a world-leading expert in the topic of work design, as well as the topics of productivity at work, mental health, and job performance. And under the SMART model, we've got these 5 elements. And the idea is if you have work that is stimulating and interesting, if you can improve, build competence, and achieve mastery, if you have autonomy or agency, there are positive relational aspects, and the work demands are at a tolerable level, then you have good work design. So what we want to do is increase the resources we have, which is the SMAR, and ensure that the demands, or the T, is at a tolerable level. And under each of the SMART elements, there's specific characteristics that we can look at. So for stimulating, this is about using a variety of skills, completing a variety of tasks, problem solving as well. And we've seen this a lot with the RNs and AINs, or assistants in nursing, in aged care, where they say things like it's never a dull moment, they get to complete a lot of different things on a day-to-day basis, makes their shift interesting. For mastery, that's about having clarity about what you're supposed to be doing. It's about getting feedback on the job, being able to finish a task from beginning to end. So an example might be a disability support worker who may predominantly work alone, so not within a team, and they're receiving positive feedback from their participant regarding the services they're receiving so that they know that they're actually doing well. Agency is about having control over how and when you're doing your work. It's also about being consulted about changes that are happening. And so again, for an example, this might look like a coordinator who maybe has a set task that they need to complete on a daily basis, but they've got the freedom and autonomy to schedule their work however they want to, as long as those tasks are getting done. Relational is about having contact and support from other people. And it's also about seeing the value, the meaning, the significance in the work that you're doing. And this is really big, of course, in a helping industry like HSA. And an example that I keep hearing is we work together as a team, or we are all there to work together for our resident. So that's a really nice example for relational. And then for T, tolerable, that's about having tolerable work and organisational demands. So things like time, workload, physical and emotional pressures. It's also about having consistency in your work processes. It's about having job security. And it's also about having really good change management so that when the organisation is undergoing change, you're not confused about things that are happening around you. And an example for this, I was actually struggling to think of an example in HSA because their demands aren't usually very tolerable. But something that we have heard is that when there is a stressful situation that's happening that's causing concern for employees, they are at a place where they're able to go and speak to their manager or to speak to someone senior. So the demand doesn't go away, but that relational component and the support makes it a little bit more tolerable, which is nice. So having good work design, regardless of occupation, can address these work stresses or psychosocial risks like the ones here. And so, for example, if you have really highly stimulating work, then it's less likely you're going to be feeling under-challenged or bored by repetitive tasks. And this is really important because when work is poorly designed, then the result is disengaged, ineffective, or burnt out employees. So because work design can influence mental health, it can influence these psychosocial risks and well-being, it's a very obvious strategy, and it provides us with a very clear opportunity to look at how is this work being designed and how can we tweak or change these characteristics to make the work better. So in the next section, I just want to run you through 2 case studies or examples where we've used the SMART model to improve work design and well-being. So in this first example, this is the project that I'm currently working on in New South Wales, and it's about shifting work design and well-being of employees in HSA. The research from our project so far has shown that from a 9-year period to 2021, the New South Wales healthcare and social assistance sector lost over 170,000 working weeks to psychological injury. And the number of psychological injury claims in this sector in New South Wales is about double than claims in any other sector. We also found that people who have psychological injuries rather than other injuries are usually off work at a much longer rate of around 13 weeks compared to other injuries, which is around 2 weeks. And that most of the psychological injury claims, I think around 2/3, relate to bullying, harassment, and then work pressures. So this is just a bit of an intro to our lead research team. So the project is being led by Sharon Parker at CTWD with Associate Professors Anya Johnson and Helen Nguyen at the University of Sydney. And we've also got Professor Alex Colley at Monash University. And Design for Care is supported by a massive team of researchers and professional staff across all 3 universities and is funded by IK New South Wales. So I've got these QR codes throughout which you can scan on your phone if you like. They'll just take you to different parts of our website that are relevant to whatever I'm talking about. So Design for Care is a 3-year research project, and it's about understanding how we can co-create good work design to improve and sustain well-being for the critical workforce in HSA. And it's really about designing better work for the people who are delivering care. And our aim is to be able to reduce the occurrence of this psychological injury claims in the industry, but also to be able to create work that's meaningful, appropriately challenging and healthy. And we're partnering with organisations across HSA in disability, foster and aged care. So these are our current 5 partner organisations, but we're expecting a couple more to come on as well. So next slide is a lot of talking, 1 second. So in terms of the process that we're taking, the way that we help these organisations to improve and sustain wellbeing is through this path process. And this is when organisations are really interested in a very intensive participatory redesign process, and we work really collaboratively with them to develop practical, smart work design interventions. So in the prepare phase, this is where we are preparing the organisation for change and to undergo the path process. So we are really working with execs to understand the organisation. We're setting up a local team to help drive the project, and we're also preparing for surveys. In the assess phase, we are running interviews and surveys. We're also conducting observations. We're looking at HR data to assess work design and wellbeing. And this stage also really helps with getting the buy-in of the frontline staff too, because we're actually engaging with them, we're on the ground, and taking the time to get to know how they see their work. Something that has been really important in this stage as well is making sure that we have a really good understanding of how the organisation functions to make sure that they can engage with the project. So for example, one of our large aged care organisations, a lot of their employees don't have email addresses and they don't spend a lot of time in front of a computer. So on our end, that looks like flying over, doing roadshows, site visits with pen and paper surveys, just to chat to them and explain what we're doing and give them an opportunity to get involved. In the reflect phase, this is after the data is collected, we will analyse the findings and put it into an interactive dashboard. Then we will debrief with the executive team and also the local team leaders as well. And we will provide them with resources on how they can understand the results, how they can speak to their teams about it as well, and how they can share it more broadly. The redesign phase, which is my favourite, after spending all this time understanding, diagnosing and reflecting, then we are in redesign, and this is where most of our organisations are now sitting kind of at the tail end of redesign. So in this phase, we're running a workshop series that's aiming to work with leaders and frontline staff to co-create interventions to redesign aspects of their work in ways that are improving and sustaining wellbeing. So the workshops are really about educating the frontline and leaders and about finding solutions as well. So we might start with educating them and talking about, okay, well, what's within my control to change? What's maybe a little bit outside of my control to change? We really encourage them to be open with sharing their ideas with us, but also prompt them to consider, okay, how are they actually going to roll this out and not just solely rely on us. Part of redesign is also working really closely with the team leaders or the site leaders to coach them through their ideas. So once they've come up with a redesign solution, we don't just leave them and let them go for it. We'll check in with them, we coach them, we see if there's anything that we can do to help them overcome any barriers, things like that. And so this part in Path is really about partnering with our organisations and the frontline staff and really encouraging them to take the lead. So we will use the surveys and the information that we've collected so far to guide us. But at every point we're asking, is this still relevant? Is there anything else we've missed? Has anything new come up? And this is really important because within the same organisation, you'll have different sites with different teams, and they might have very similar challenges, but they'll come up with very different solutions and different ways to approach it. So it's really about what they think, they being the local team, think will work because they're the experts, they're the ones working in that space. In the track phase, we again run interviews and surveys to see how the redesign ideas have impacted the organisation, and to see the effect that it's had on their work design and their wellbeing. And once we start to enter this phase and get an understanding of what's working under what conditions and for who, then we'd like to be able to share our findings. And then finally, the habituate phase. This is really about providing recommendations on 2 points. One is about how they can embed the changes that they've carried out into the daily functioning of their organisation to make sure that it's sustainable and not dependent on us. And then the second part is about scaling up. So we might have only had these interventions done in a few trial sites, and the organisation might be interested in rolling out across the broader organisation, so providing them with recommendations and help for how to do that. So this is just some of the outputs of the project so far, and they're available on our website, but they've been really instrumental in sort of setting the scene in terms of what does a psychological injury landscape in New South Wales look like, what risk factors should we be aware of, and then most recently, what's the role of work design in shaping mental health. Just want to share some findings with you. So this is from our most recent report. And in this sample from our 5 partnering organisations, we found that 1 in 5 are reporting high symptoms of work-related burnout. 1 in 6 people are feeling disengaged, and then 1 in 12 are actually considering leaving their organisation within the next 12 months. We also found that younger age groups, so that 16 to 24 age group, are more likely to experience higher mental ill health compared to other age groups. And also that the permanent full-time employees experience the highest level of work demands compared to casual workers. When we asked about work design, we had 70% of our respondents report that there were okay levels of smart work design, so some strengths and some weaknesses, but we had 15% report that there were poor levels of smart work design. And if we look at the top 5 psychosocial risks most important for managing mental health and wellbeing in this group, they were mainly related to tolerable demands, which is not surprising, particularly around time pressure, emotional demands, and work-family conflict. Next was related to mastery and specifically role clarity, which again was understanding the tasks, but also understanding the relationships that they're supposed to be having at work. And then finally, related to stimulating was around opportunities to develop. And this was a really big one because we had 90% of respondents saying that they did have opportunities, but they just may not have time to actually access the opportunities to develop. So from here, what it looks like is we now start to redesign the work and help them roll it out by changing the systems, maybe deeply redesigning some roles, maybe just tweaking a little bit how some tasks are done. All with the intention to improve wellbeing at work. And the key thing here is that work design, it's not operating in a silo, so it's really important to consider every characteristic and also how they relate to each other. And this process is just an ongoing and very collaborative process, so stay tuned. Also the findings, I guess, is another thing to mention here. So the findings from our project, we're still obviously in the middle of the project at the moment, so I haven't got a lot to report back on. But our plan is to have that informing a suite of recommendations for the HSA industry in terms of how to embed SMART into organizations as a preventable and sustainable strategy for addressing mental ill health. So take a breath. So now I just want to talk to you quickly about SWANS, which was another research project. And we found that Australian studies have shown that about 22% of surgeries experience something called an adverse event. And of those events, you've got almost half of those that are preventable. And so if we look at the half that are preventable, 70% of those were the result of a communication failure. So SWANS is the Surgical Work Team Advanced Non-Technical Skills Project. And it's an example of a completed redesign. This project investigated how non-technical skills like decision-making and communication can affect surgical staff and cost outcomes. And the project was funded by the WA Department of Health. The surgical teams were experiencing these preventable communication breakdowns, but preventing it can be a bit of a challenge for 3 main reasons. One was because of the multi-professional team. So you've got nurses, surgeons, anesthesiologists, and a lot of diversity of knowledge and experience, which is essential. but each discipline has its own way of communicating and speaking. The second challenge was around lack of stability, so that it's not always guaranteed that they'd be working together in the past, and sometimes they would get into surgery and they wouldn't even know each other's names before they get into the surgery for the day. So that low familiarity can be really difficult because it's hard to know your own and then other people's roles, but it's also really hard to predict the behavior of other people if you're not familiar with them. And finally, there's really strong hierarchies in surgical teams and differences in power. So this can make it really difficult for lower power groups to feel safe and competent to speak up. So the research team, they observed operating room behaviour, they conducted surveys and interviews with the surgical staff. They also analysed organisational data that related to efficiency at some major hospitals in WA. And then the team consulted with relevant stakeholders before introducing this multi-professional briefings process to 3 of the hospitals here. And briefings are 3 to 5 minutes long, where they did introductions, they covered relevant case information. It provided an opportunity to raise questions and then a summary from the discussion. And the briefing had 2 main aims. The first was to facilitate information sharing by giving an opportunity for team members to discuss professional opinions, determine everyone's role, develop contingency plans as well in the event of complications. And if we think back to the SMART work design model, this is aimed at improving mastery and specifically role clarity by making sure everyone was really on the same page, very clear about who's doing what, and has a very clear understanding about how we're going to achieve our shared goal. The second aim was around opening communication channels among the team members. And this was really important for the teams who hadn't, or the people who hadn't worked together previously. So it was about helping the team feel more comfortable speaking up to raise concerns, and that in turn allowed for problems to be raised and then solved more efficiently. And this is speaking to the R, that relational component of smart work design, improving the support within the working team. So in terms of outcomes, there was a number of outcomes. They had increased operating theatre efficiency. There was a potential for economic efficiency gains. And this was based on really highly conservative figures used in the research. So they estimated that if the program was adopted by all surgical teams in WA, then the efficiencies would equate to over $3 million saved annually. There was also improved patient safety and then better theatre staff engagement as well. So I just wanted to round out talking about those 2 examples with some reflections and observations in terms of what you guys could do to ensure redesigning work to improve wellbeing is as effective as it can be. And these are mainly my reflections from Design for Care. The first is at looking at the root cause. So if we think about the example that I mentioned with EAP, it can be really effective for people who are stressed out and burnt out to seek counselling. But to actually be preventing harm, you need to be addressing the root of the issue and not only the surface level stress or the symptom level stress. I need to be asking, okay, why is that happening in the first place? What is it about how the work is designed that's causing that stress? It's not enough and it's not sustainable to address problems like this with just counselling or just giving people a week off work alone. And attention really equally needs to be paid to addressing the root cause, the work design issues, but also the symptoms that we see. The next takeaway is around making sure it's a collaborative effort. So at every stage, this is really important. So it's not just enough to ask once or to do a survey once, particularly in HSA where there's such a high turnover in some of these organisations. But really to make this effective, asking at every opportunity, is this still relevant? What have I missed? Did I ask the right questions to begin with? Has anything changed? So just keeping those sorts of questions front of mind. The next one is around it being iterative. So out of the workshops, the teams may land on a redesign solution or an idea that they want to carry forward, but we need to manage their expectations and ours, just letting them know that we may have to be flexible. There may be things that we need to tweak or changes that need to happen as we go, or we might be piloting this idea and testing it in one area and then go back and change what didn't work before we roll it out. So just keeping that front of mind as well. Regarding leadership as well, just making sure that You've got stable and committed leadership. That's really important. Our path organisations in particular have been absolutely incredible to work with in terms of their enthusiasm and their commitment to the entire process. And something that we've seen as well is that the change and redesign can be really effective in organisations and teams that are supported by their executive leadership, that have the stability and have the consistency and of course are committed. So this is a really key strategy to making redesign work. And the last one is just around system alignment. And this is around, so these changes that the teams are coming up with, they aren't all standalone and siloed sort of solutions. They will have impacts on other systems. So making sure that you're aligning these changes with the wider systems to support the change is really important in making sure it's actually embedded. So for example, with SWANs, training was offered for these multi-professional briefings and people were able to self-select in. But if we actually wanted to ensure that all staff attended them, then that means changes to the roster to ensure that they're actually rostered on the day when the training is happening. And then that means changes to the pay system to make sure they're being paid for their time. So then there's all these additional layers of complexity and the wider systems of rostering and pay that then need to be considered as well. I just wanted to share as well that CTWD is hosting a first of its kind work design conference in Perth early next year, and there'll be some optional pre-conference and very practitioner focused workshops as well if anyone's interested. And we'll also be hosting stream specific sessions as well. So there will be like a healthcare specific stream and I think one for mining as well. So stay tuned for more info. And if you're still interested in learning more about work design, Curtin runs our Curtin credentials. And this one's actually starting in a few days on the 18th. It's more about the theory of work design and really deeply understanding what work design is, why it's important, and the different approaches you can take to designing work. We also have a range of workshops that are available for organizations, from essentials that's suitable for anyone in the organization right up to strategic planning workshops that are suitable for leaders and exec. And we're also in the process of setting up a smart work design accreditation as well. So that's coming soon as well. And that is all from me. Thank you so much for taking the time to join and listen, and I'm happy to take questions.
Wonderful. Thank you so much, Cati. Really appreciate that.